Hello everyone, my name is Boris Karaman. Thank you for tuning in to my presentation. Today I want to address key issues that will see our organization improving its quality of care, especially on the area of healthcare-associated infections, HAIs. Just like you all, I want to ensure that no more HAI cases are experienced. For this reason, we want to come out together as people to tackle these pressing issues. Stay tuned as I delve deeply into this matter, and the main goal of my presentation is to enhance the quality of patient care by focusing on research-based improvements. Per author Blott et al., the results of data gathering, processing, and reporting are essential for the enhancement of the quality of outcomes. And to optimize the quality of patient care, I will provide a quality improvement initiative supported by benchmarks and data. The metrics collected by the institution involve factors like patient satisfaction and nursing communication, barcode medication verification, pain reassessment, and other optimal outcomes data. These metrics are a way of measuring the quality of the healthcare services being provided. The description of metrics like patient satisfaction and nurses' communication reveals growth dimensions that give a broad outlook. Goals focused on the outcomes of care, such as barcode medication verification rate and frequency of pain reassessment, make it possible for the organization to set goals that can be worked on. According to the data given, the cases of HAIs have significantly reduced with the depletion of the patients with contracted HAIs, down by 16% in the year 2024 from 2022. This positive tendency that can be observed as an indicator of adherence to better infection prevention and control practices. Nevertheless, the examined data also disclosed a concerning trend toward heightened rates of particular sorts of complications that include CLABSI and CAUTI, for the rates which were up by 9% as well as 11% correspondingly in 2022. They indicate that even though the global rates of infection are being enhanced, there are other paths that require attention and treatment. The quality of data collected is very important while analyzing the general tendencies and the fields that should be optimized. For instance, CDC has stated that in the year 2015, about 3% of the hospitalized patients had one or many HAIs, and in the year 2018, over 72,000 patients who had HAIs died during the period of their hospitalization. The data presented above also enables one to establish whether or not a process is constant, whether it is improving, deteriorating, or fluctuating, and to identify trends and performance failures. Due to this, an orderly approach to data helps the hospital effectively evaluate the success of its endeavors in managing healthcare-associated infections and improve the approaches used in the provision of patient care. This slide is rich with quality indicators or measures. Current quality initiatives pertaining to the prevention and control of healthcare-associated infections, HAIs, need to be assessed to determine how efficient they remain in meeting set standards and where they may lack. Examining these indicators may reveal areas for improvement of the quality, for example, the optimization of catheter-related care and staff education concerning infection risks. These metrics are useful in evaluating the success of disease prevention techniques, trends, and gaps which would facilitate the development of policies that can improve patient safety and care delivery in healthcare facilities. The data trends from the previous slide reveal that though HAIs are on the decline, further focus has to be made towards certain types of infections incidences, thereby target mechanism aimed at providing lower morbidity and mortality related to HAIs. The choice of the Quality Indicators QI initiative will follow the Plan, Do, Study, Act PDSA model, as it ushers in the systematic and cyclic process of identifying, evaluating, and improving interventions. Core targeted measures will comprise of effective antimicrobial stewardship program, use of hand hygiene effective measures, use of training on aseptic techniques, and use of highly effective disinfection schedules. Detailed training programs tailored for the healthcare staff will include coverage of the necessity to follow protocols to minimize the risks of infection spreading. Per the initiative proposal, the goal set is to achieve a 15% reduction in CLABSI and CAUTI rates in the initial year of its rollout. The execution phase will be centered on organizing training sessions as a means to engaging all the healthcare staff such as nurses, physicians, and ancillary staff. The following measures for infection control are going to be implemented in all relative departments. The level of compliance is going to be controlled through observations and self-auditing tools. To ensure that the above-mentioned measures are effective, the necessary data about HAI incidence rates and adherence to guidelines, patient outcomes will be gathered and scrutinized. From this perspective, improvements to the protocols and the training programs for handling such patients will be made to address the issues pointed out in the presentation, and effective practices will be scaled up to other departments of the healthcare facility and possibly other related healthcare facilities in the network. This cycle will be ongoing since the researchers will build on the previous findings and enhance the quality of the interventions. There are several missed knowledges and uncertain factors that must be discussed. It is very important to assess HAI rates before implementing the intervention to avoid comparing with inaccurate or incomplete data. Standard ways of assessing and documenting the levels of adherence to the regulatory or recommended measures in the prevention and control of infection must be established. The identification of different patterns of implementation combined with the knowledge of what each intervention contributes to the decrease in the HAI rates will help recognize the most effective practices. HAIs have been a focus for quality improvement efforts with comprehensive interventions requiring a multidisciplinary approach. The tangible roles and responsibilities involve infection control specialists who are responsible for the development and evaluation of the infection prevention and control measures to be followed. The nurses play a key duty of enforcing hygiene and procedural measures that should be followed. And lastly, the physicians who are charged with the responsibility of prescribing the correct antimicrobial treatments that should be administered to patients. To this end, hospital administrators must assure these efforts by allocating time and resources into campaigns and supporting policies. Thus, it is critical for all the involved roles to undergo daily interdisciplinary meetings to help them communicate, join training sessions to acquire a similar understanding of teamwork, and guaranteeing that all the roles have their responsibilities ensured and valued. For instance, system thinking and data analysis are concepts that can enrich the initiative because of the goal to develop a clear picture of infection and make evidence-based decisions. Further, knowledge in the subject of organizational behavior enables management for change and culture for improvement. Outcome measures are critical in assessment of the impact of the intercessions and include the rates in occurrence of HAI, mortality, and other certain rates in exceptional infection, including CLABSI and CAUTI. These milestones assist the interprofessional team to evaluate the process, health gains, and mounting challenges before redesigning the strategies and activities. As a result of the efficiency of the applied initiative regarding the quality of work life, a decrease in AGIs among the patients directly contributes to patient care outcomes and simultaneously leads to the improvement of job satisfaction and diminished stress levels of the nursing staff and, more broadly, the interprofessional team. Altogether, through data analysis, our institution compiles important data like patient satisfaction index, rate of nurse-patient communication, barcode verification of medications, frequency of pain reassessment, and rate of incidental overtime. A well-coordinated plan involving charts and tables allows us to evaluate the data output while the patient satisfaction rate and nurse interaction show where we need to advance. Tran et al. 2021. Hospital Consumer Assessment of Healthcare Providers and Systems, short for HCAHPS, and pain reassessment rates are examples of outcome measures whose calculation is dependent on figures produced in the data. Process monitoring and the determination of performance gaps are important things to consider. According to the results of the data analysis, the proposed quality improvement initiative complies with the standards created by healthcare policies and laws. In order to close the above-mentioned gaps, it is proposed to redesign the processes and implement evidence-based practices, comparing their results with external benchmarks. Effective involvement of all the roles, clear duties and responsibilities across professions, and incorporating non-nursing constructs are crucial for our initiative. The identification of the right channels of communication, such as holding of daily team meetings, and the adoption of formal communication models, such as the CUS, where you formally state the concern, then identify why it is uncomfortable for you, and lastly, if the dispute is not resolved, you voice that there is a safety issue. Along with SBAR, which stands for situation, providing background, describing assessment, and offering recommendation. Those models will help to foster interprofessional relationships, which will be key to the success of the outlined performance improvement plan. The administrative data includes items like excluding authorized leave, truancy, working beyond scheduled time, and working off-shift hours. The quality data was specific to unit initiatives such as barcode medication checks and pain rate assessments. Based on the mentioned multiple data points, a report was developed that helped in tracking the results in what is known as the report card, Turcot et al. 2023. The report cards were discussed and analyzed by the nurse managers, who agreed on the right actions to be taken, such as rewarding and availing of personal development and training programs. Two outcomes are first identified: barcode medication verification and incidental overtime. Although goals were disengaged following the automation of processes, past data items were retained on a monthly basis in order to strengthen goals and facilitate the fine-tuning of goal accomplishments when they did not meet expected outcomes. First, in the communication domain of the HCAHPS survey, the percentage size stake implemented increased by 12% on the first unit. In the second unit, the nurse communication domain raised by 3%. The incidental hours were initially decreased on Unit 1 by 41% and also on Unit 2 by 32%. Concerning the quality indicators pertinent to barcode medication verification and rates of pain reassessment in Unit 1, the corresponding advancements revealed by the data amounted to 11% and 8% respectively. The quantitative results on Unit 2, which had higher baselines at the beginning, are that barcode medication verification rose by 1% and the rates for pain reassessment by 5%, Tran et al. 2021. These favorable results show that quality enhancement drive was beneficial to the organization. Healthcare-associated infections are an important area that our organization aims to tackle for once at a moment. We want to ensure that patients are well handled by improving hygiene. In general, we target to promote collaboration among healthcare providers to ensure that patient outcomes are improved. I would like to thank you all for your time and attention. Please let me know if you have any questions. I will gladly answer them. Thank you.